I'm pleased this afternoon to be able to introduce Jim Manzi for this symposium to discuss rapid cycle testing lessons from the private sector. Jim was founder, CEO, and chairman of Applied Predictive Technologies, which became the world's largest cloud-based predictive analytics software company, and which was sold to MasterCard in 2015. So that's impressive. Previously, he worked at AT&T Laboratories as a corporate strategy consultant. Mr. Manzi is the author of several software patents, as well as the 2012 book Uncontrolled, which I highly recommend. And the book has been widely reviewed in the New York Times, Wall Street Journal, other national publications. He received a BS in mathematics from MIT and was awarded a Dean's Fellowship in Statistics to the doctoral program at the Wharton School at University of Pennsylvania. So welcome, Jim.
Thank you. I feel like I'm in a boardroom with 3 people in it. Everyone has room to sit and enjoy their lunch. Well, thanks very much, Mark. I appreciate that. I wanted to just have a pretty interactive session. It's billed actually as Lessons from Business. The title I put on the slide is Observations from Business. As I was saying in a little breakout session a few minutes ago, I'm not really certain at all about how applicable the way business experimentation works is to how it ought to work in social policy. I've given that question some thought, but really at this point I only have theories. So what I thought I'd do is begin with a quick summary of kind of what it is that shaped my theory of the case about how to apply experimentation to make decisions. One, as Mark indicated, is APT, which is a company I started about 15 years ago, actually, like 1 mile from here in my apartment, which ultimately became a fairly large global software company. But as I'll get into, the primary product that APT sold was and is software that's used to design, interpret, and action in-market experiments, RCTs, for businesses. And so I'll talk about some of the things I think I observed there. Second, as Mark also indicated, I wrote a book in 2012 as relevant for this conversation. The most relevant component of that is I attempted in that book to catalog every social policy randomized field experiment ever done in the developed world through 2008 in the fields of criminology, education, social welfare, economics, and political science. I don't think I got all of them, but I think I got most of them. And I'll have some observations there as well. And then a couple of years ago, I funded a little research center at the Brookings Institution, which is trying to evaluate, can you apply some of these techniques and methods that have worked in business into social policy experimentation. So that's just kind of so you understand where I'm coming from a little bit. Let me start with a motivating example of a real and actually a fairly important business experiment that was done about 5-6 years ago. Google, as you all know, is a giant company, and Google has a product called AdLinks, which is one of their 2 primary sources of revenue. And the way it works is, if you do a search and something comes up as sponsored search, there's a little blue box to the left of the name of that company or the name of that link, and if you click on that link, Google makes money, right? And it brings you to whatever advertiser paid Google money to have their search result there. So the question on the table was, what shade of blue should that little box to the left of the link be? And so a group of designers did a bunch of work and did a bunch of focus groups and said, you know, it's that shade of blue that consumers respond to the best. And it turns out there's another group of designers who stared at Mount Fuji and said, oh, you know, actually it's that shade of blue works best, and here's the evidence we have for it. And rather than have a debate about it, what Marissa Meyer, who's in charge of this division then at the time, did, said, you know what I'm going to do? I'm going to randomly assign 50,000 people to go to links with that shade of blue and randomly assign another 50,000 people to go to the other shade of blue, and we're just going to see which works best. Right? That is the classic, when a business is particularly online, is called A/B test. One's A, the other's B. They then made the observation that, I assume everybody here does presentations a lot. You use PowerPoint? Everybody here use PowerPoint sometimes? Okay. Do you know when you go in and you're going to set the shade and there's that like weird hexagon type thing with all the different tiles of different colors? What they observed is, actually, there are 42 shades of blue we could choose from. And we're just going to assign people to every possible shade. And this is the famous 50 shades of blue experiment, which is actually 42 shades of blue, to be technical. And that's how they decided what color ad links are, right? So that's just kind of a super practical version of this. Now, I'm going to describe a test to you right now that hasn't yet been done. And as background to this, after I sold my company, I started another company, and what we do is build new data science, machine learning businesses, get them stood up, and spin them out as independent companies. And one of the things we're working on right now is a company that is a gift recommendation engine. So the kind of classic use case is my spouse's birthday is a week from now. I have no idea what to get him or her. I kind of go and get them a tie or a scarf. I give it to them. They look at me and they kind of have to pretend to like it, but actually what they're really thinking is you don't care about me and you don't know me at all as a person, right? And the problem, of course, is if I am a week in advance, I say, oh, I'm a good guy, I'm looking at this a week in advance, I'm going to go online and look for great gifts for people who like to cook Italian food. What I get is a list of great gifts for people who like to cook Italian food for which this website makes money, right? So they're all tainted. It's very hard to actually get personalized, meaningful gift recommendations. So we've built this technology which attempts to do that. And in order to support it, well, of course, you have to do a bunch of advertising to get people to go and try it out. And so one of the ad campaigns which we want to go test is this particular campaign is built around the idea of showing that disappointment that the receiver has as a motivator for the person to try this. So the ad campaign will be tested on Facebook. So like in a Facebook feed, this sponsored ad appears, and it's going to have a picture and some text around it, which basically says, here's the problem, click here to get the solution. And the goal is to get the person to click on the picture to go to get their gifting problem solved forever, right? So in this test, there are 5 possible pictures we're thinking about as potential pictures to use in this test campaign. So we're all going to play ad executive, right? Here are the 5 alternatives we're looking at. One is kind of disappointed-looking middle-aged dude, right? 2 is disappointed-looking middle-aged dude with text that says, what, you thought I'd like that. 3 is A minus B plus celebrity Kristen Wiig looking disgusted and contemptuous. 4 is nice old lady looking very contemptuous. And 5th is kind of a cartoon. I've made it larger so you can read the text, basically saying, your gift was a heartwarming reminder of what thoughtless bastards the vast majority of my friends are. So the question is, which do we think of these when distributed widely to English language adults on Facebook is likely to lead to the highest click-through rate? Which will lead to the most positive response? So we're going to do a little survey. I'm going to go around the room, and everyone should raise their hand 1 time total during this survey, and we're all going to vote for what we think is the best one, all right? So I'm going to start with middle-aged guy with no text. Who thinks this is likely to be the best? Raise your hand. Basically nobody. Okay. Middle-aged guy with text. Who votes for that? Also, now a little bit more. Okay, we have a few people. All right. Kristen Wiig. Maya Rudolph, sorry. I can show you my level of cultural awareness. Don't ask me about sports or I'm really in trouble. Maya Rudolph. Okay, so she gets the most votes so far. Nice older lady. 1 person. I guess the last one's going to get a lot of votes because almost no one voted yet. Who votes for the last one? All right, the clear winner. All right, so what I'm going to do is while I'm doing this talk, I've just kicked off the experiment. So if all goes well, by the time I finish this talk, we will have executed a randomized experiment and served this to approximately 100,000 English language speaking adults all around the world. We will have gotten the results back, analyzed them, and have the answer. And if we're correct, the cost of that should be around $350, right? So a lot of what I'm going to talk to you about is making experiments fast and cheap. And one of the things I'm trying to illustrate with this is in certain contexts, that can be very fast and very cheap. And there's a lot of power in that. Okay, so let me move on with our regularly scheduled programming. We'll come back to this at the end, and hopefully I will get a text from the guys at the company telling me what the result was. So if you think about a business applying randomized experiments to try and find out what the effect of some intervention is, what happens if we change price? What happens if we run this ad copy versus that ad copy? What happens if we train people who work in our stores differently, et cetera? There are two different contexts in which they can happen, and they matter a lot for how you design the experiments. So think of a hypothetical large, mid-size bank in the United States, a retail bank. They have 1,000 branches and 3 million customers, okay? This is like a standard, 20th, 30th biggest bank in the country. So some of the experiments they run will happen online, like the one I just talked about. So here it might be, should we change, unlike the Google Ad Links example, should we change the shade of blue on our homepage? You go run an experiment, just like I've described doing in the case of Google, just like we're doing right now live in the world. It actually launched a couple minutes ago. And the sample size per cell is on the order of tens of thousands, right? Okay. Now, what if I want to run an experiment which is not online? And I suspect for most of you, these are much more relevant. It's almost the same thing, but it's, should we change the shade of paint on our branches to a different shade of blue? I run a randomized control trial. The problem is I can't pick 10,000 random branches and run the experiment, right? I can pick like 20 or 16 or 40, right? Small sample size creates a huge number of analytical problems, and actually the big, the intellectual basis essentially of my company, APT, was building a bunch of mathematical algorithms for dealing with this challenge of how I run experiments with very small sample size. Okay, so the kinds of things a business might want to try and experiment with are some of the things we talked about so far, but should I do the 10% off or buy one, get one free? Should we keep the branches open an hour later at night or not? It's easy to measure, did people buy during the hour from 6 p.m. to 7 p.m., but you really need to know the incremental attributable effect on total performance, which TV ad really drives sales, et cetera, et cetera. I think these are in a certain way very analogous to kinds of interventions we often want to execute in social programs, training the delivery people differently, changing the incentive calendar, changing the way we do outreach, right? They're really analytically the same kind of problem. So one of the key points I'm going to make to you is executive alignment, which is a polite way of saying the people who actually own the rights to make the decisions, being willing to change decisions based on test results, is the absolute requirement for this to create any value. So this is a quote from the guy who runs Subway, basically saying test and learn, which is kind of our plain English version of saying repeated randomized control trials, helps us be maximally creative and risk-taking. We test exciting but risky ideas before we roll it out and do the ones that work. If this is a bunch of analysis done for other analysts, and the people who own the rights to decide, are we going to change this program design, don't once say, I'm pretty sure about what ought to be done here. But when we mix the red chemical and the blue chemical, it turns green. I'm going to take a decision which doesn't seem intuitive to me because of test results. If that doesn't happen once, there is no point to doing this. And as I'll come to at the end, I think this is likely the biggest barrier to execution in this sector. So when I started the company and started bringing this idea of rapid iterative experimentation to non-niche parts of businesses about 15 years ago, it was really a pretty controversial idea. Bit by bit, company by company, we converted a lot of the economy. So, this will take a long time. So basically, if you take every time someone in America last year went into a store and bought something, or purchased something online, or purchased something in a catalog, about 20% of those transactions are going through our database. Meaning there's about a fifth of the consumer economy that is currently deploying these concepts of rapid iterative experimentation that I'm talking about. It's not really a science project. Okay. So I'm going to get, having been a little bit motivational about, gee, we're doing all these tests and it's great and so on, I'm going to get a little depressing for a minute. All right? And I'm going to start by defining what I mean by a successful business program and a test. So I will define a business program as being proven successful through testing if the following is true. in a controlled experiment, which in practice means randomized test and control groups, in which the control alternative is the action that we would otherwise be selected as best by the organization, you don't get to compare to sugar pill, you have to compare to standard of care, right? Other than this new program variant, this new training program we're testing, we compare it to the way we would otherwise train our people, or whatever. So far, so good? In a controlled experiment in which test is compared to control, where control is defined as the action I would otherwise take in the absence of this alternative, the tested program creates statistically significant improvement in a pre-identified outcome in the test group versus the control group, right? So the test group has to do better than control. It has to be statistically significant, and I can't play the p-hacking game of, well, I don't know, there's like 10,000 things I measure, and guess what? I found one that works better, right? I need to say in advance, I need to pre-register the way I'm going to measure this, all right? So it's better, test better than control, and it's statistically significant. That improvement generates benefits greater than costs. So if I compare the new program to the best alternative, and I take the improvement, and I take, if there's any incremental cost in this program, and compare the improvement to the cost, it creates improvements greater than costs. And it can be replicated at least once, right? So when I say success, I mean that, which is a pretty, I think, intuitive definition of how you would make a decision when you're running an organization for, is a program really proven to be better? If I look across tens of thousands of experiments across all those different company logos I was putting up in the APT database of experiments, about 90% fail, right? So like, when we try something and we really subject it to testing, something like 90% of the time it doesn't work. The new training program is not better than the old one. The new price point doesn't make you more money than the old one. And it's not just that all those great marketing companies that are on the APT system are dumb. Actually, Google and Microsoft have published the results of thousands of experiments, very similar results. Right? So that's kind of a sobering idea. In Uncontrolled, I tried, as I said, to go through every RCT I could find, and I found a large number. And when I looked at coherent, comparable groups of program tests, like what the IES at the Education Department published a whole series of experiments, and you look at those group of education experiments, researchers at Cambridge went through the process of trying to collate every RCT done in criminology intended to reduce crime rates from 1950 roughly to 2004, et cetera. You actually see very similar results. Using a less stringent definition of success, where there's no cost-benefit test, it simply does test outperform control at level of statistical significance. Failure rates are in the 90s. Interestingly, if you look at new drugs as they're introduced and enter phase 1 clinical trials, a pretty similar percent actually successfully complete phase 1, phase 2, and phase 3 RCTs and are then released as safe for marketing. So that's kind of depressing in a way, right? And I know what you're all thinking. I'm in the 10%. Right? My program is, I'm one of the 10% that work, right? Because I know it works. But when you look around the room, you're not all in the 10%, and I'm not either, right? It is the reason why you do tests is humility. It's recognizing that it's actually extremely hard to go from something that sounds good and in observational analysis looks good and operators believe is a good idea to something that actually creates improvement. And if you think about it, it's actually kind of intuitive, right? You're trying to create an improvement in an operating system that was not run by idiots until yesterday. It's run by a bunch of people who are trying to do the best they could. New ideas that are correct are very rare. Okay? This is a very important conceptual step to take when thinking about testing. To accept that this program that I've spent a lot of time, program improvement, I spent a lot of time thinking about, if I'm a good Bayesian, I should be pretty confident I'm wrong. Testing is panning for gold, not proving to the funder that my thing I know works really does work. Okay, so what's the solution? You kiss a lot of frogs to find a prince. You have to try lots and lots and lots of ideas to find one that works. In the presence of weak theory, which is what we have about non-coercive, non-chemical interventions in human social systems, you need to try lots of things, and through trial and error, find things that work. What Edison was talking about in that quote was trying to figure out how to make a long-burning filament in a light bulb work, which was the fundamental problem in being able to roll out electric lights. They literally, they had these huge banks of light bulbs in which they just tried different materials. Animal materials, vegetable materials, paper, everything. That's how they found the long-burning filament, right? He didn't fail 10,000 times. He disproved 10,000 ideas and eventually found the one that worked. Okay, so pretty depressing, but kind of painful how you solve it, but there's a solution. But unfortunately, it gets worse. Okay? A further depressing observation is when I look among those tens of thousands of experiments, and I think this is true in social experiments too, you look at the small subset that did something positive in test versus control. In magazine articles, it's things get 20% better. In real life, things get like 1.2% better and 0.8% better. That those programs that do work usually have small effects. Right? This is certainly true in businesses. And so, how do you deal with that? You kiss a lot more frogs. It further emphasizes the need to run lots of tests to find the small number of things that work, because you don't just have to find one or two things that work, you have to find a bunch of things that work. So the metaphor in a business for this is you build a mountain of pebbles, right? You're trying lots and lots and lots of tests, and you're finding this one that makes me a little money, this one that makes me a little money, this one that makes me a little money, and you build up a mountain of pebbles. And it turns out to be worth a lot of improvement. You also want to set expectations correctly, because a standard in a business for, I do this program of lots and lots of experimentation to find lots of little edges, in concept, you're kind of improving performance about 5% in total. This isn't about taking a basically broken system and making it work. I've never seen testing do that. I've never seen experiments do that ever, and I've been doing it for a while. It takes a basically functional system and allows it to perform at a higher level, which is, by the way, free money, right? This is what productivity looks like. This is what productivity is. You're just figuring out how to make decisions differently in order to improve performance. Okay. It gets yet worse. So, almost nothing works. When it works, its effects are small. And a further problem is those effects are almost always conditional, right? So, in the heroic era of RCTs in medicine, we discover pertussis vaccine, right? It's the first well-structured that I ever found in my research RCT ever was done in Virginia. And it was proving out the performance of pertussis, which is whooping cough, vaccine. And you can do a pertussis vaccine trial in Norfolk, Virginia in 1938 and safely conclude through the reasonable, tolerable engineering assumption called uniform biological response, that if I put this chemical in the bloodstream of people in Norfolk, Virginia in 1938, it will stop whooping cough, that's going to work in Saskatoon, Alaska, or urban Detroit, or suburban Ohio in 1970, right? If instead I were testing a literacy program and proved that second grade phonics works better in this class set in Norfolk, Virginia in 1938, I can't conclude that therefore it's going to work better 30 years later in Columbus, Ohio, urban Dallas, and suburban Canada, right? Effects for non-coercive, non-chemical interventions are almost always conditional. So, what do we do about that? I suspect you know what I'm going to say. Let me give you an example of exactly this problem in a social intervention. So this is a very famous series of RCTs, at least among RCT nerds. And what was done was in the early 1980s, a randomized trial was done to test the effect of different police interventions when arriving at the scene of domestic violence complaint. It was done in Minneapolis. The traditional solution was you arrive, it is typically a man beating a woman or being accused of having done so. The traditional remedy is the police would send the guy away for a cooling off period. And so what they did is randomized individual police responses in a very well-designed test into three possible alternatives. One was traditional remedy. A second was to provide assistance. And a third was mandatory arrest. You just arrest the guy on the spot and you put him in jail. And it was shown in this experiment that there was a statistically significant lower rate of repeat calls for domestic violence for the mandatory arrest group. Right? If you look over the next 12 months at the probability that the same person is going to be, have another domestic violence call, it was down really pretty substantially in the mandatory arrest case. So this was hailed as a triumph of scientific knowledge. We now know mandatory arrest is the right solution, or at least a solution which produces reliably the following outcome. So, over the next 10 years, roughly during the course of the 1980s, by 1990, mandatory arrest became a standard practice in a majority of large jurisdictions in the United States, largely credited to this experiment. Now, the researchers, who were very careful researchers, said at the time, look, you really need to do some replications of this to make sure this works in a wide variety of contexts. So as it was being rolled out as a scientifically based policy, over that period, they did a series of replications. So if we look at the first original experiment in Minneapolis, what you see is a very large reduction in rearrest rate, negative 50-something%, in test group versus control. The next column is showing it's statistically significant, and the far right column is saying it is both statistically significant and in the right direction. So that's green light. So when you look at the replications, yellow light is no result. Red light is it went the wrong way, right? It's basically a coin flip. Now, what the researchers observed looking at this is that actually in neighborhoods or districts where you had total social dysfunction, arresting the guy just made him angry. This is their theory, and he came back and was worse. And in places that were more socially functional, arresting him shamed him into not doing it again. Now, in a business sense, you would say, okay, that's a theory I've built based on this series of experiments. Now I'm going to go run more experiments to test that response surface, right? Hopefully, it would not take 20 years to go through the cycle, right? So, as I said, it gets worse because most things don't work. Those that work have small effects. And then this issue we just talked about, those effects are conditional. Like, it's not enough to know, typically, the average effect. You need to understand the conditions under which the effect's going to be positive versus negative. Finally, it's actually conceptually a version of conditionality. Those effects are almost never permanent. In physics, we discover permanent physical laws which are true for all time, right? Certainly in business experiments, there's an expression in businesses which is ice cream melts. And what that means is I do all this work to find this causal relationship that I can rely on. If I train this way, performance goes up. If I change price like this, margin goes up. I will guarantee you that for virtually any effect like that you find, as soon as you find it, it's already going away. And the only question is how long. You have to keep repeatedly testing to find when it's gone away. So, here's some really depressing news. Successful behavioral interventions are rare, small, localized, and fleeting. I am describing to you my understanding of facts about the world, not a desire, right? So, the solution, you all know where I'm going to go, right? More cowbell. Even more tests. So there's a part of the solution which is continuing to radically drive down the cost per test in order to be able to do lots of tests. But interestingly, this concept of conditionality actually is not necessarily so depressing after all. So, it offers a key to a solution. Here, remember, program fails means does not create improvement in mean performance in test versus control with positive benefits versus costs. However, almost every program actually creates improvements for some members of the test group, right? the mean effect may be negative or zero or significant but not economically justifiable. But there is a gradient to response across members of test group virtually every time, and that gradient tends to be very significant. So another way of saying this is, actually, every program works to some extent. It works for some people, for some units of analysis. So the real question, if you have the capacity, and we were talking about this in a breakout session, and Laura and others from ABT were having this very interesting, presenting very interesting findings around this. If you can unlock the black box, there is hidden causal insight inside the black box, right? So really, the better question to ask than does the program work or not is actually whether we can reliably identify the subpopulations for whom it works and whether we can deliver the program to them with feasible scale economics. So if it works for 2 people in America, that's an interesting insight, but I can't really act on it. If it works for 40% of the population, so the net effect is negative, but actually it works for 40% of all the people in the United States, I can probably act on that. So what I would say to you is, if the metaphor for the evidence-based policy movement is to just basically fundamentally ask the question, what works? I think typically a better question to ask is what works where? Like that's really what you need to know as a practical operating person, I think, generally, in order to get value out of this. Okay, so in the last couple of minutes, what I want to do is give you at least my hypothesis for what this would imply about how testing would work in a large social policy delivery organization if you accept the data I've kind of shared with you. So my overly simplistic metaphor today, and I've used the field of education as an example here, is out there in the world there are a bunch of principals and teachers and schools and students, and they're out doing things. And researchers observe this and develop some theories for improvement. It would be better if we did, phonics in 2nd grade for these kinds of students rather than those. And eventually, if some of those theories are viewed to be valuable enough to justify an experiment, we go and we run an experiment, right? And we do a formal randomized control trial. And the entity doing that is conceptually like the FDA, right? Because it then publishes into a what works clearinghouse. This intervention's good, these 3 don't work. And that information is attributed down to the practitioners who then do the programs that work and don't do the ones that don't. And I think this is fundamentally built from an analogy to the way clinical drug trials work, which interestingly is evolving, but certainly the way they have historically worked. And I think where the analogy breaks down to some extent is in the historical age of randomized controlled trials for pharmaceuticals, uniform biological response as an engineering assumption meant that, like, the drug works, the drug doesn't work, was a useful piece of information. If you accept this idea of conditionality is central, conditionality by time, conditionality by type of recipient, conditionality by background environment, et cetera, then it's much less useful to me as a practical operator to say, oh yeah, this thing works, that thing doesn't, because my question is, does it work for me? Which if I'm a doctor and I'm talking about a vaccine, the answer is yeah, it works for you. If I'm running a school, it's not so clear it works for me because it does on average across a big population. So there is a role for this kind of experimentation for huge long-term questions, but actually for most operational questions, if you accept what I talk about, you kind of flip this upside down. And a different theory is, or kind of cartoon for how this might work, is I have a school system. They're operating, the districts, they've got school buildings, they've got classrooms, they have teachers, teachers' aides, students, and so on. And actually, I am running thousands of experiments inside that large school system every year. I'm sometimes randomizing at the building level, sometimes at the room level, sometimes at the individual teacher level, sometimes for students inside live computer testing, I am running live experiments inside those computer education modules, et cetera. And that really, the role of the experts is that of providing capability. It's providing the capability for an organization with sufficient scale to be able to do this. Right? It's a completely different way, I think, to think about it, and I think it is appropriate for certain kinds of questions, likely, as opposed to others. Okay, so I have, in fact, gotten a text telling me the winner of our experiment. So it has completed. So for those of you who came in while we're talking, at the beginning of this session, in fact, I cheated because about 10 minutes before the start, we launched a live experiment in which we tested with it turned out to be about 104,000 people while I was doing this talk, have been exposed out there in the real world in their Facebook feed to 5 different advertising messages to see what click-through is best. And the clear favorite of the group was that the lower right cartoon, which is very funny, would be the best. Turns out it was the worst. The best is the older woman, yeah, which I believe got the absolute lowest number of votes. So you'll note that I didn't vote. And the reason I didn't vote is there's another expression for when you have these rapid cycle tests called getting slapped in the face, which happens all the time when you try and guess what response is. Virtually nobody is better than a coin flip at doing this. So hopefully with this little kind of toy experiment, although, it was 104,000 people all over the world, told us, or illustrated, is a couple things. One is humility. We might think we know, but we almost never know when people are not coerced. When people are free to do what they want, it is extremely hard to predict the effects of our actions upon them. And the second is, the limit case of how fast and cheap experiments can get is an hour and $300. So, that's my talk. I think we have about 10 minutes left. If there are any questions, my only advice to you is what's there, which is keep calm and continue testing. Thank you. Yeah, that's our IP, so. Yeah, it's basically, we built, at my old company, which I no longer own, we built a bunch of algorithmic technology to deal with this problem. And the issue fundamentally is when sample size gets small, law of large numbers doesn't apply anymore, so a lot of classical statistics breaks down. And so what you end up having to do is all kinds of, what are in effect, layered bootstrapping techniques to try and get reliable estimates of variance and therefore reliable estimates of causal impact of programs. And obviously going into that is way beyond the scope of this conversation today. It is always better, all else equal, to have larger samples. At large sample sizes, our methods and traditional statistics will converge, obviously. But across, at this point, about 15 years and tens of thousands of these experiments, we've been able to prove out that it is possible to get reliable estimates and reliable confidence intervals around small sample experiments. That's really why we had a company. Yes?
Could you say a bit more about your center at Brookings and what kind of organizations you're working with and what kind of tests you're doing?
Right now, almost none. There are currently, I just don't know what's covered under confidentiality agreements. Right now in K through 12 education, there is one umbrella organization which is attempting to apply this across a set of probably a few dozen school districts. And there is one state child welfare agency which is attempting to implement this kind of a capability. It's early days on both of them, so I really can't give you any odds of what I think the likelihood of success would be. The purpose of that center was very much to try and answer the question, can you apply these things? Not assuming that they can be applied in this context, and I still don't know the answer. Yes, Stephen.
Is the corollary to your gloomy facts about the world that almost all impact science that doesn't use randomized trials is harmful? It will find better solutions, and they aren't better. Let's stop doing that.
Yeah,
I'm allowed to say that.
I wrote a book to try and answer that question broadly, and so the way I'd summarize it is non-experimental methods, in my view, are best seen as theory building. It's not that they're not valuable, but that they are alternative ways of developing theories that you ultimately want to test. There's some things you can't test, and you have to make decisions. Lots of things you can't test, and you have to make decisions. But the kind of mental map, I'd say, of people in organizations is there's kind of operators who are out doing stuff, supervising people, getting stuff done, and they're creative people, and then there are the nerds, right? And one sub-tribe of nerds are econometric kind of modelers, and one sub-tribe of nerds are testing guys. A better mental model is econometric modeling is a species of theory building, not a species of program evaluation. So it's extremely valuable, it's just its purpose is different than testing. That'd be my sort of 3-sentence answer, but you will quadruple sales of my book if 3 people here buy it, and you can read more about it there. Yes?
Hans Bos at the American Institutes for Research. The thing that I think was most depressing about your presentation is this need, where you started at the beginning, like for people who have a controlling influence about how things are done to actually buy into the results of these experiments. And I have a 2-part question. First of all, do you think that is a surmountable problem in a political environment where public programs are operated? And if not, I would like to know. And the second question, the sort of positive side of that is, you showed all of these different companies, 20% of the US economy that used your systems. Were you able to convince all of those CEOs and all of those, you know, directors of marketing and such to actually believe the findings, use the findings, adopt the findings? And if not, why not? And if so, how?
Great, those are great questions. The answer to the first question is I don't know whether it's a surmountable problem or not, which is kind of the basis of my answer previously. I don't know. I think that if you take the perspective of imagine 2 worlds, the world where you have the results of lots of well-structured, thousands and thousands of well-structured experiments around discrete tactical policy questions, and the world where you don't have that information, I believe that the first world will outperform the second world. So I think there is some benefit. That's a pretty low bar I just set, but I do believe that. I think that the political, as I said at the very beginning, the issue of the real motive, basically when push comes to shove, the willingness of those who control decisions in public sector organizations to break China, to make the organization perform 3, 5, 6, 8, 10% better on performance metrics, I don't know. It might be the null set, you know, people who are prepared to do that, and those who have control over those decisions. It's my view on it, though, is very related to the second part of your question, which is the way we went about getting to 20% of the economy wasn't convincing 20% of CEOs. It was convincing one CEO in 2001, and a second one in 2002, and a third one later in 2002, and a fourth one in the fourth quarter of 2002, and eventually we got to 20% of the economy, right? You know, we ate the elephant one bite at a time because the only way we could do it. So I will say that I think the best shot, my guess, and it's only a guess, is the best shot at really answering that question in a productive way is not to try and convince these people as a group, but to find one person sitting in that seat who's prepared to try it and see if he can make it work.
So I was going to ask a similar question. Mark Testa, University of North Carolina. I have both your Kindle edition as well as the hard copy of Uncontrolled.
Excellent, excellent.
And so I was going to talk about this sort of virtue of humility that's often lacking in political leaders, but thinking, how do we overcome that? Donald Campbell talked about in the past the same problem. And so rather pay for success, maybe we should be encouraging payment for experimentation, recognizing that if you do 10, don't get fired for the 8 that fail, but get rewarded for the 2 that succeed. And I wonder how we integrate that ethic into public policy.
Yeah, that's another great question. You know, again, I don't want to overgeneralize from my prior experience, which may not be relevant here, but my belief is that if you get those who control, have decision-making authority around the relevant programs, to believe that testing helps them to make better decisions, to perform, so their organizations perform better, they will force the introduction of the relevant metrics into the organization. They will insist that they happen. A very direct, I think, application of what you just described is when you think about foundations funding nonprofits, often now there's, in my opinion, sometimes productive and sometimes unproductive dance of, we're the funder, we want to see an RCT before we put money behind this to prove that it works. And it's kind of like, you know, I wish here, when you visited planet Earth, you met some humans, because, like, let me get this straight. You want me to run an experiment to determine whether the thing I've spent 20 years doing and I'm devoting my life to is a good idea or a bad idea, and I'm going to get a thumbs up or a thumbs down. I mean, that would be like running an RCT on, is Walmart a good business, right? I think a much better metric is exactly what you just described. My view is a foundation funder should want to know, how many tests did you do last year? And I want to see the results of those tests, and I better see a lot of failures. Because if I see that you did 74 tests and had 71 successes, no way. You are the greatest genius in history, or this is crap. You're not really running tests to improve decision making. That'd be one practical, I think, place you could implement what you talked about.
Charlie Homer from ASPE at HHS. Fascinating, wonderful presentation. Your observation that this kind of testing results in incremental small improvements and is premised on there being an underlying functional system. I mean, you know, Microsoft, whatever its challenges, knows how to, you know, make computers or make software, whatever
Right.
it does. Many of us would not describe the social environment, right. The social service sector in quite that way, especially if we're looking for sort of order of magnitude of reductions in poverty levels or
Yep.
improvements in outcomes. And so do you have insights as to what produces that kind of second order change and the role of testing for that?
Right. So I don't have an insight, but I've thought about this question, because I've done a couple, I'm really a technologist, I don't do a lot of public speaking, but I've done a couple talks on this subject. And this question has arisen, so I've thought about it some, and I guess the way I'd put it is this, like, it's very straightforward to say, if I were emperor of the universe, how would I change this program? But I actually face all kinds of constraints on my freedom of action. So the real actual decisions in front of me are highly bounded. And it's not so obvious, if I don't want to assume away all those constraints, what changes I would do to create improvement. So it's not clear to me that, it's just really clear to the operators what you ought to do differently, unless you get to assume away constraints, which you don't really get to assume away. So while versus some abstract ideal, are public sector organizations dysfunctional? Sure. Like every organization, Microsoft is totally dysfunctional versus an abstract ideal. Every group of human beings is. But they're not dysfunctional versus the alternative decisions I could really make here in the real world. So I wouldn't assume that there are just these huge improvement opportunities sitting out there waiting to be discovered. I don't think, maybe these very large scale, what I would call almost scientific tests, where you're looking at 30-year effects of gigantic program changes, those might lead to huge unlocks over a long period of time. I don't think the kind of testing that I'm describing and the kind of testing that I've seen leads to giant unlocks. It can add up to a big improvement, but it gets there by building a mountain of pebbles. I'm sorry I can't tell you, here's the way to do that, because I've not seen that ever happen.
So you might have already implied what your answer would be, but I wonder if you could speak to the current wave of social impact bond mechanisms and your thoughts about that.
I don't know a lot about it. I've spent some, it's interesting that Third Sector Capital, I think, has been probably a very successful organization in that environment. It's actually headed by a guy I know pretty well, who, fascinatingly, is one of the very early people who started Capital One, you know, the bank and the credit card company. Capital One, I remember when it was an idea in a conference room, also about a mile from here. I had an argument with Rich Fairbank, who's the guy who started it, and like he won the argument, right? That company was built as a platform for rapid randomized experiments. That was literally the purpose of that's why they picked credit cards, was to do rapid iterative RCTs. They do about 60,000 RCTs per year. So at least the portion of that world of social impact bonds I've been exposed to comes from that tradition. I think it strikes me as very well thought out in concept, that you basically have a randomized test in a control group, and there's payout created by performance versus the control group. I think the general experience has been that it's very difficult to actually make that a profitable transaction for anybody on a totally self-interested, profit-driven, Goldman Sachs is going to do it other than for PR reasons basis. And that to me indicates that it will be likely harder to scale up than people think it will be. That if you can find something where there are good returns on capital, you can then pour a fire hose of capital at something and grow it very quickly. And I think that's the high-end promise of social impact bonds. I don't think anybody's yet cracked the nut of how to make it attractive to a purely self-interested investor. If that happens, I think it'd become a gigantic thing. Until that does, I think it probably is very difficult to grow it very rapidly. But again, I'm not an expert in the subject. Great. Well, thank you all very much. I really appreciate your time today.